Concern is also growing for doctors and nurses working tirelessly to help COVID-19 patients and contracting the virus themselves at an alarming rate. 140 employees at one hospital alone, the Brigham and Women's in Boston, testing positive. Matt Gutman has much more on that story this morning. Good morning, Matt.
Hey, good morning, Michael. Given their daily exposure, I suppose it's not surprising that healthcare workers are getting sick. But here's what's disturbing. Experts are now telling us that the viruses are like poison, and the higher the dose, the more fatal it can be. And so higher doses combined with poor protective gear are making for a dangerous combination.
Frontline health workers themselves are turning into patients at alarming rates, and it's being called an epidemic within an epidemic. 20% of COVID-positive patients in Ohio and Minnesota are healthcare workers. In Boston, over 700 healthcare workers testing positive. They are exposed to the virus more than anyone else.
Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament.
Experts say it's not just the frequency of exposure, but also that healthcare workers are exposed to larger doses of the virus as well.
When you get exposed to a virus, your immune system immediately starts mounting a response. At the same time, the virus starts spreading within the body. An outcome depends on which wins the race, viral spread or the immune response. When you start with a high dose of virus, it gives it a head start in the race.
Meaning the virus can overload the immune system of even the healthy. People like Frank Garbin.
And by then, his breathing was almost non-existent. And when the paramedics arrived, they tried to revive him for about 45 minutes.
Garbin wasn't just any COVID patient. The 60-year-old was an ER doctor, the first in the nation to die from COVID. His best friend, Deborah Lyons, on the phone when he passed.
And he also knew exactly when he got it. He knew it was those 4 shifts that he had to use the same mask. He knew it.
What do we want? PPE!
Shortages in protective gear triggering protests in California and Kansas City. Nate is a nurse in New Orleans.
What are the biggest shortages you're seeing on the day-to-day?
I think we're short gowns, obviously the disposable isolation gowns, the N95 mask. We're using masks for 5 to 7 shifts generally.
Reusing the same masks over and over. Masks are stored in those brown paper bags on those racks. But even when they do have proper protective gear, medical professionals can fall ill.
I did everything right, and I still came up positive, so I'm not really sure what's going on there.
Yet still doctors and nurses are turning up every day. And despite all of that danger, volunteers are now turning out in droves. In California, New York, Colorado, over 120,000 retirees or people in other areas of medicine have volunteered despite all of that danger to join the fight against COVID-19. Michael.
Yeah, all heroes on the front line.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.